In this video, we will talk about the balloon therapy. And balloon therapy has been around for a very long time, and it is a non-surgical therapy for weight loss.
It's the latest weapon deployed against one of the 21st century's greatest scourges, obesity.
Is reviewing a new type of gastric balloon that starts as a pill. In clinical trials, patients lost an average of nearly 7% of their body weight in 6 months.
It's really for people who have been severely obese for many, many years.
Well, that's the promise of a new breakthrough procedure.
And they say you won't be hungry. How about that?
It basically is a restrictive therapy which restricts the amount of food that a patient can take. इसमें basically क्या करते हैं कि एक बलून को मुंह के रास्ते से पेट में डाल दिया जाता है और उसको सलाइन से इन्फ्लेट करते हैं. तो ये बलून आपके पेट में जगह ऑक्यूपाई करता है और आपको ज्यादा खाने से रोकता है. Because of this action, gradually the patient will lose weight. देखते हैं कि करीबन patients का around 10 to 15% total body weight loss certain duration में होता है बलून डालने के बाद. There are different kind of balloons which are available in our country, and there are mainly 3 types of balloons which are there. So we have one which is currently very popular, which is also known as the swallow pill, जिसमें कि कोई एंडोस्कोपी करने की जरूरत नहीं होती है. पेशेंट मुंह के रास्ते से एक swallow pill जो है वो निगल लेते हैं पानी के साथ में, एंड उसको फिर बाद में एक ट्यूब के द्वारा उसमें से हम पानी भर देते हैं, एंड 3-4 महीने के बाद वो बलून अपने आप डिफ्लेट हो जाता है और वो स्टूल में निकल जाता है. एक्शन जो है मैकेनिज्म वो सेम ही है, क्योंकि बलून आपके पेट में जगह ऑक्यूपाई कर रहा है और आपको कम खाने के लिए, मतलब आपका खाना कम हो जाता है उसके बाद. द अदर टाइप ऑफ बलून्स basically require an endoscopy for insertion. So we have 2 types. One is a non-adjustable balloon where an endoscopy is done. A balloon is inserted and it is filled with saline. Once that is done, the balloon is left inside, but the duration is longer. तो वो balloon हम करीबन 6 महीने के लिए आपके पेट में छोड़ सकते हैं. 6 महीने के बाद वापस एंडोस्कोपी करके उस balloon को deflate किया जाता है और उसको निकाल दिया जाता है. The third type of balloon actually is even better, where there are 2 advantages. One is that कि ड्यूरेशन उसको जितना रख सकते हैं वो काफी लंबी है. तो फर्स्ट बलून जो मैंने आपको बताया था वो 4 महीने के लिए रह सकता है. सेकेंड बलून कैन स्टे इनसाइड फॉर 6 months एंड दिस थर्ड वन कैन एक्चुअली स्टे इनसाइड फॉर 1 year. एंड इसका एक और एडवांटेज है कि इसको हम एडजस्ट भी कर सकते हैं, कि इसके अंदर हम एक बार जो सलाइन भरते हैं उसमें हम दोबारा से ऐड भी कर सकते हैं. सो अगर आपका वेट लॉस प्लेटो हो जाता है, सो सपोज इफ यू फिल्ड इट इन विद से 500 cc of saline and you lost weight for 4 months and then you feel that the weight loss has plateaued, then we can go in and instill some more fluid into the balloon and maybe it will kickstart the weight loss again. So that facility is available in this particular type of balloon, and it also gives you weight maintenance for a little longer period of time. So these are the 3 different types of balloons which we have available, and whichever balloon is done, the result would be almost the same. So any balloon would lead to a weight loss of say about 10 to 15% of your total body weight, and it is important also to note that once the balloon is out, then there are chances that you will maintain for a certain period of time, but there will be some degree of weight regain that can happen once the mechanism for restriction of intake is removed from the body. So we need to be very diligent with the diet and lifestyle post balloon removal as well. Thank you so much.